Thank you to all of you, and thank you, Renee, for that wonderful introduction. And I'm excited to be here to talk to you a little bit about the research findings over the past 15 to 20 years in the field. And I'm going to share my screen, and we will start up here. Okay. Let me move this one little thing over here. Okay. Well, first of all, I want to acknowledge that a lot of this research I'm going to present, it's not from Europe. And, really, before I even begin, I'm going to acknowledge the research that has been done by European investigators. René Hefti has been publishing up to literally the last few months, been doing research in this area. There's Arjan Braam, and I saw Arjan just briefly here as he was introducing Deborah, or concluding Deborah's talk. But there's Arjan Braam, who's done such incredible work there in the Netherlands, and his wonderful work. And then Deborah Lycett and what she's been doing in the United Kingdom. My gosh, what exciting work. Her and her graduate students. And then there is Niels Hvidt, who has been doing some great work in this whole field, and publishing and mentoring students and all of that. Such exciting work. And then Arndt Büssing taking the lead from Germany in terms of massive amounts of research that he's been pouring out from his program over the past 20 or 30 years. So I want to acknowledge each of these major European researchers and their contributions to this whole field that has resulted in this European conference. So having said that, I'm going to dive into this presentation. Okay. So first of all, I will talk about the role of faith in coping with stress, the relationship between faith, mental health, and social health, the effects on physical health. I will also talk a bit on the global flourishing study, whose first wave of results has come out and been published within the last year. And then we'll look at some models to try to understand how faith influences health, provide some further resources, and I hope to have a little time for Q&A. Okay, many people understand that people rely on their religion to cope with stress in life, especially health problems and threats to health. Often used to cope with uncertainty, fear, loss of control, discouragement. We turn to religion, we turn to our faith to make sense of these things, to give these events meaning that otherwise would just be senseless. Does this do any good? Does this help people to do this, to turn to their faith when they encounter stress? And even when they're not encountering stress, involvement within a faith community, studying their holy scriptures, trying to live lives according to those scriptures. Does it make a difference? Let's look at mental health first of all. Depression, as you all know, anybody who's a therapist here knows this is the major reason why patients come to see us. It's really one of the most common emotional disorders in the world, and the most disabling of all of the mental health conditions. And when we did a systematic review of this literature back in 2012, and this did include studies out of Europe, there were 444 studies we identified, and of those studies, 272, or almost 2/3, found that religious people experience less depression, and when they do become depressed, they recover more quickly from it. And religiously integrated interventions reduce depressive symptoms with large effect sizes when studied in randomized controlled trial. Here is a study looking at young people who were followed for up to 6 years, 10,000 young people. This is out of the Harvard School of Public Health. They're looking at their religious attendance at baseline and then seeing what impact that has on their risk of developing a depressive disorder during that follow-up time of up to 6 years. You can see here that those attending services at least weekly are about 30% less likely to develop a depressive disorder. Now, these are young people, average age of 23. And the methodology used to analyze this prospective data is the most latest methods that, again, Harvard School of Public Health, this is the place that has developed these methods of statistical analysis. This is a study out of Columbia University. This is published in JAMA Psychiatry. It's looking at MRI scans and the brains of individuals at high risk for depression. And this is the findings. Among those who indicated religion was not very important, you'll notice lots of areas of red, which indicate that the cerebral cortex is thinner in these areas. Now compare that to the brains of those for whom religion is very important. A whole lot less red in these areas across the brain. And in fact, there is approximately, on average, a 1 millimeter thicker cerebral cortex among those who indicate religion is very important in their life. Of course, the most feared consequence of depression and many other mental disorders that we as mental health professionals grapple with is suicide. And in our systematic review in the second edition of the handbook, published in 2012, bear in mind that there is a third edition that I'll show you a little bit later of the handbook, published in 2024. But this is the second edition that was a systematic review of everything that had been published up to about 2010, 2011. And there were 141 quantitative peer-reviewed academic publications that were identified in that second edition. And of those, 75% show that religious people have fewer suicidal thoughts. They are less likely to make suicide attempts, and they are less likely to end their lives by suicide. Here is a study out of Brown University in Rhode Island. That's way up north here in the United States. But they analyzed data on an 18-year follow-up of over 20,000 randomly selected Americans. And they looked at their risk during those 18 years of dying from suicide. And what they found was that those attending religious services twice a month or more were 94% less likely to commit suicide, independent of gender, age, size of the household, previous suicide attempt even, and drug use. Then this is another article out of JAMA Psychiatry. This is, again, the Harvard School of Public Health. These are nurses, 90,000 nurses that have been followed for up to 14 years. You can see here that the suicide incidence among those attending services weekly or more during that 14-year follow-up was 7 times higher among those who never attended religious services. Again, we're talking about nearly 90,000 nurses prospectively followed for 14 years, and a 7 times greater risk among those women who never attended religious services. And once you controlled for 24 other predictors of suicide, there was still an 84% reduction in risk. This is looking at deaths of despair, again published in JAMA Psychiatry, again the Harvard School of Public Health, looking at deaths from alcohol, drugs, and suicide. And you see here a nearly 70% reduction in risk among those attending religious services weekly or more. They've controlled for 25 other psychological, social, and physical health predictors of deaths of despair, even prior religious attendance. And still, they have this finding that is highly significant. You can see this by the 95% confidence intervals. And there's a P for trend in the data, suggesting that this, based on the way they did this analysis, that this was not just a correlation, but that this met the criteria that qualified these findings to be causal. Yeah, not 100%, but about 90 to 95%. Based on the way they did these analyses, they found a dose effect in the relationship, and this P for trend indicates that this highly likelihood that this was a causal relationship, that religious attendance, in fact, was preventing the deaths of despair, not just correlated with them. Here is the study in men. So these are 43,000 men, male healthcare professionals, followed for over 25 years. Once again, when you look at the findings, those men who are attending services weekly or more are nearly 50% less likely to die from a death of despair. These are age-controlled analyses. What about the positive aspects of mental health? We was talking about depression and suicide, and those are the negative aspects. What about the positive aspects? Happiness, well-being, life satisfaction. The findings are even stronger in the positive aspects of life. 8 out of 10 studies, 80% find that religious people are just happier. They have greater well-being. They have greater life satisfaction in the vast majority of studies. And in fact, less than 1% of studies show that the more highly religious person is more depressed, or has lower well-being or happiness, less than 1%. 80 times more studies showing that religious people are just happier. What about other positive emotions? Yes, they tracked right along with happiness. Greater meaning and purpose in life, virtually all of the studies. Greater hope, 75%. Greater optimism in over 80%. And you know, if you've got patients who are recovering from a heart attack or a stroke or cancer or whatever, and they're in the hospital and they're having to go through rehabilitation, it makes a big difference if they have meaning and purpose in life, if they're hopeful, and if they're optimistic about their future. They're just going to work harder to get better, and they're going to recover more quickly. That's the bottom line. Social support. Religious people have more friends. They have more social contacts, and these social contacts endure over time. Even when the social support can't be returned, religious people support one another. They do it not just because of the social exchange, or what's called reciprocal altruism, not just because of that, but because of their beliefs that instruct them to love their neighbor as their self. That's an additional reason to provide support to others. Divorce, domestic abuse, single-parent families, all less common among those who are more religious in 80 to 90% of the studies. Religion is good for marriages. It's good for marriages. Keeps people together, keeps families together. This is another study out of the Harvard School of Public Health, a 14-year prospective study of 66,000 initially married nurses. And if you look at their religious attendance at baseline, it's predicting a lower risk of divorce or separation in 40 to 50% of, it's a 40 to 50% reduction, with again a P for trend, suggesting that this is causal, not just correlational. Health behaviors. Religious people don't use as much alcohol. They don't abuse it. They don't become dependent on it in 80 to 90% of the nearly 300 peer-reviewed academic scientific papers. Illicit drug use, the same finding. This just came out a month ago in JAMA Psychiatry. This is out of the Harvard School of Public Health, once again. The lead author here is Howard Koh, who is has an endowed professorship in the Harvard School of Public Health and the Harvard Kennedy School. He was actually the United States Assistant Secretary of Health for the Department of Health and Human Services under President Obama. So this is a world-renowned scientist and academician. And he, they did a meta-analysis of 55 studies that included over 500,000 participants. They found on average a 13% reduction across studied drugs and alcohol among those who are more religious. And this effect increased on average to 18% among individuals participating in spiritual or religious communities. They reported that virtually all of the 134 effect sizes that were present in these 55 studies, virtually all of them demonstrated a protective effect of religious involvement, with multiple sensitivity analyses confirming these findings. I mean, what more research do you really need to come to the conclusion that religious involvement can help to protect against different illnesses, particularly substance use disorders? Cigarette smoking, 9 out of 10 studies showing less smoking among those who are more religious. Most of these studies are among young people, which means that religion can help to prevent the onset of cigarette smoking, which will affect the person's entire future life of a young person. Exercise. Religious people are more likely to be physically active and be exercising. They're less likely to engage in risky sexual behaviors. And so their risk of getting sexually transmitted diseases, HIV, all of these diseases are lower. Now, their weight. I know that Deborah was talking to you a little bit about eating, and there was a question in the audience that said, what else do we have, than our eating of the delicious food? That is not against any religious rules to eat. And certainly religious communities encourage eating. But the problem is that religious people tend to be heavier. They tend to be heavier in the majority of studies. What about physical health, immune functioning? The majority of studies show that religious people have stronger immune systems that fight off infections, cancer, all of those horrific things that are trying to kill us. Here is one of the first studies. We did it here at Duke, and this was 1,700 older adults. We looked at their pro-inflammatory cytokine, IL-6, which is an indicator of immune functioning. The higher the levels, the worse your immune system is. IL-6 levels go up with aging. And so as people get older, their immune systems begin to weaken. IL-6 levels go up. People with HIV and AIDS have high levels of IL-6, again, suggesting their immune systems are struggling. But those who are more active in their religious community have lower levels, significantly lower levels of IL-6, indicating stronger immune systems. The study was replicated at the University of Iowa 7 years later, showing that, in fact, the lower IL-6 levels among those who attended religious services more frequently explained the effects on mortality among these older adults. Those attending religious services lived longer. And the reason why they lived longer was because their IL-6 levels were lower. In other words, their immune systems were working better. Now, this is a study of largely dentists. It's looking at risk of developing infection around the gums, called periodontitis. So that's what dentists do. They treat people with periodontitis. But among dentists, if they're involved in religious meetings, they're 25% less likely to develop it themselves. And this is independent of age, smoking, body mass index, alcohol use, diabetes, marital status, social support. All of these covariates are controlled for in this another prospective study over 4 years. Now we're looking at viral load. We're actually measuring the concentration of AIDS virus in the blood of 382 HIV positive individuals who were followed for 12 months. Those who are currently attending religious services at the beginning of these 12 months later, the concentration of virus in their blood was 50% lower among those attending religious services at baseline. So attending religious services at baseline predicted a 50% reduction in the concentration of viruses in the blood of those who were HIV positive. Here's a study looking actually out of the United Kingdom, looking at antibody response to the COVID-19 vaccine, showing that those who were more involved in a religious community had a significantly more vigorous response to the COVID-19 vaccine. Here it's looking at severely ill people with COVID-19 who were hospitalized with the condition. It's looking at their mortality. The in-hospital mortality was 14 times greater among those who scored low on the centrality of religiosity scale, which is, in fact, a measure that came out of Europe. Cancer, less common. Here's a study among young people. Here's the 10,000 young people that they've been following for up to 6 years, and they're looking at attendance, and young people attending services weekly or more are 2/3 less likely to develop cancer over a 6-year follow-up. These are young people, average age of 23. Young people don't get cancer. But apparently some of them do, but not those attending religious services, or at least, the risk is lower. This is over 500,000 US adults that are followed for 15 years looking at cancer mortality. We find here that on average, there was a 10% increase in risk of dying from cancer among those attending religious services less than once a month. On average, about a 10% increased risk. Among African American women, there was a nearly 1/3 greater risk of dying from cancer among those attending services less than once a month. Here is another Harvard study published in JAMA Internal Medicine looking at cancer mortality over, I think, a 14 or 15-year follow-up. Again, those attending services even more than once a week are more than 20% less likely to die from cancer. Those attending weekly, 14% less likely. And those attending to any degree are nearly 10% less likely compared to those who never attend. And there's, once again, a P for trend or a gradient of effect. Now, this helps to explain why. Why is it that those who are more religious are dying from developing and dying from cancer less often? It's because they have a more active cancer suppressor gene. We all inherit this gene called the cancer suppressor gene. And this study found that those who are more religious, that gene is more active. It's more active in terms of suppressing cancer cells. Cardiovascular disease and stroke. Once again, lower blood pressure, better cardiovascular functions, lower risk of coronary heart disease. Here's a study we did, 30 years ago, 3,600 older adults. Once again, average diastolic blood pressure here in North Carolina was significantly lower among those who were attending services once a week or more and reading their Bible and praying at least once a day or more. So if they did both of those, they had the lowest risk of, they had the lowest diastolic blood pressure. Another study out of Harvard, this is 44,000 women, again, nurses without high blood pressure who were followed up for 12 years. And this is looking at their frequency of attendance at baseline and their self-reported hypertension 12 years later. Again, almost 10% reduction in risk among women attending more than once a week. This is looking at death rates from stroke, again, out of the Harvard study among the nurses. And any degree of religious attendance is lowering the risk of dying from a stroke. This is looking at Jewish men in middle age. These are Jewish civil servants and municipal employees, 10,000 that are prospectively followed for almost 25 years. And there's about a 20% reduction in risk of dying from a heart attack among those who are attending synagogue, doing the Jewish rituals in the home, sending a child to a Jewish school. Those were the items on the orthodoxy index that they administered, and that was prospectively examined in terms of predicting death from heart disease. Here's looking at cardiovascular mortality in the Harvard study. Here you have a nearly 25% reduction in risk from dying from cardiovascular disease among those attending more than once a week, 20% lower risk among those weekly attenders, and almost 10% among those attending to any degree compared to non-attenders. Looking at open heart surgery. Again, this is an older study. This is about 30 years old, yes. So it's outside of that window of studies I'm supposed to be, summarizing here. This is 6-month mortality. This is out of New Hampshire, out of Dartmouth Medical Center. A nearly 14% reduction in risk of dying during the first 6 months after open heart surgery among those with high religious coping and high social support, much of which likely was religion related. And, this makes perfect sense because we know that stressors influence the speed of wound healing and risk of infection. And if people are more religious, they're coping better with these health problems. They have lower levels of stress, better immune functioning. Those wounds are healing more quickly, less infection. Makes perfect logical sense. Overall longevity, yes, religious people just live longer on average. 70% of our systematic review found that on average, if you're a white person, you're going to live 7 years longer. If you're an African American, you're going to live 14 years longer if you're attending religious services compared to if you're not attending. This is all-cause mortality out of the Harvard study, a nearly 1/3 reduction in risk during the 14-year or 16-year follow-up of dying from all causes, nearly 1/3 reduction. Again, a P for trend, a gradient of effect suggesting this is not just correlational, not correlational. Nope. that this is highly likely to be a causal relationship. Now, you can't determine that definitively without a randomized controlled trial, because there could always be something else that could explain this effect. But the way they did these analyses, this comes awfully close to being causal, to establishing causality with this gradient of effect. What about something other than attending religious services? Maybe you don't like going to church. Maybe you're more introverted, like me. I go to church, but it's largely because my family goes and I want to go. And I want to be faithful too, but I don't particularly like going to church. But even if you don't go to church, if you're praying, that's going to make a difference. This is a study published a couple of years ago, a national random sample of the US, looking at cumulative survival among those who prayed daily, who prayed in less than daily, and those who never prayed. So among those who never prayed, they're dying off more quickly. That's all that's to it. And those who are praying daily or more, they're more likely to survive during this 80-month follow-up. Now, if you want to really live longer, don't just pray. Pray for others. Don't just pray for yourself, because if you're praying for others, that's going to have an even greater impact on your longevity. This is a study of a large group of HIV positive patients followed for 17 years. And they're looking at cumulative survival over those 17 years or 200 months. You can see here that those who indicated that they prayed for others are surviving significantly longer than those who said they don't pray for others. What about dementia and cognitive functioning? At my age, this is a real concern that I have about, my cognitive functioning. Well, if you're more religious, at least in this study looked at Alzheimer's disease patients. These are all patients with Alzheimer's disease. If they're scoring high on religiosity, they're nearly 7 times less likely to have a 3-point decrease in their mini mental state exam during a 12-month prospective period. This is looking at episodic memory. And it appears that praying to like God is what's making the difference here, and that meditation is not having much of an effect. So at least in this is only one study. I think meditation does make a difference, but in this study they didn't find it made any difference in terms of at least episodic memory compared to prayer that did. What about physical functioning? This study is out of Europe. This is published in the European Journal of Epidemiology. 14,000 older adults followed for 9 years. Prospective study, controlling for baseline health, European region, gender, age, education, marital status, and employment status. Those who were the most religious, in other words, those who reported praying, taking part in a religious organization, and being religiously educated, they were about almost 25% more likely to retain their ability to function as they grew older during this 9-year period. This is a study that got a lot of negative press from Parkinson's disease organizations in England and the United States. But this was an extremely well done study involving nearly 10,000 people followed for 7 years, controlling for 17 other predictors of risk of developing Parkinson's disease. But those who indicated religion was not important at all in both the United States and England had a 10 times greater risk of developing Parkinson's disease. A 10 times greater risk among those indicating religion was not important at all in their lives. Now, the Global Flourishing Study, a $43 million study that's coordinated by Harvard, Baylor, the Gallup poll, and the Center for Open Science. Over 200,000 participants in 22 countries from 6 continents with 5 annual waves of data collection. This is a 5-year prospective study. The initial wave of data collection was in 2022, and just within the last year or so, the first set of scientific papers, 34 papers, were published in a special issue of Nature. I don't know if you know about this journal, Nature, but Nature is one of the top 3 science journals in the world. We're talking science journals, mathematics, biology, genetics. I mean, Nature is one of the world's most renowned journals, and they published, 34 papers, or Nature-related journals published 34 papers, and they have detailed information about human flourishing on mental health, social relationships, generosity, character development, health behaviors, physical health, even financial well-being. And they're looking at least in this first wave of papers, they're looking at the effects of current religious attendance and religious attendance at the age of 12, which was retrospectively asked. And what they found was in virtually all of the studies and in virtually all of the countries, including Northern Europe, frequency of religious attendance was related to better mental health, better social relationships, greater generosity, better character, better health behaviors, better physical health. I mean, this pretty much closes the book here in terms of the scientific evidence that religion is good for your health. Here is how we try to understand this relationship. Begins with, now this is a monotheistic model. We also have Eastern models and secular humanism models, but this is the monotheistic model for Jews, Christians, and Muslims. So the source of these benefits is faith and trust in God in this monotheistic model. That's the source. That is nourished within a faith community. It's affected by peer influences, education, and training. It's manifested by public religious practices, private religious practices, religious commitments, religious experiences, religious coping, and those then are influencing decisions people are making in their lives, lifestyle choices, health behaviors, screening practices, compliance with treatment. It's also influencing the human virtues of forgiveness, honesty, self-discipline, altruism, generosity, humility, gratitude, patience, dependability, which are then affecting positive emotions, enhancing social connections, neutralizing negative emotions, which are then affecting immune, endocrine, and cardiovascular functions, ultimately affecting physical health and longevity. Bear in mind that this is all influenced by genetic factors, by epigenetic influences, by personality, etc. And it's a complex relationship, but and this is a theoretical model, but the evidence seems to back it up. So in conclusion, based on the best available scientific evidence, those who are more religious simply live healthier, happier, and longer lives. Religious involvement is related to better mental, better social, better behavioral health, and improves these aspects over time. And there are extensive physical health benefits as well. There are important clinical applications and public health implications of this research for Europe and countries throughout the world. Here are some further resources. I write an e-newsletter, comes out every month. Just go to our website. You can sign up for it right there, spirituality and health at duke.edu. We're doing a full day workshop on faith, holiness, and human flourishing. We had one on May 16th. We have another one on June 20th. If you're interested, here's my email. It talks about human flourishing and how holiness influences it. And it provides 8 different tools that you can use in terms of coaching, in terms of your own life to achieve human flourishing. Then I've got a workshop on moral injury on July 11th. I haven't talked about that, but it's really growing, this issue of moral injury. Not so much in Europe, to some degree in the United Kingdom, but it's, Australian and throughout most of the world, moral injury is a big issue. Moral injury is basically the emotions that result from transgressing moral values. We have a 5-day workshop at Duke University. This is the one that René attended 20 years ago. We're in our 22nd annual workshop, 5 days. Again, send me an email if you're interested. Come to the United States and learn about how to do research in this area. And then following that is a full day on clinical applications. Here's our website. We have a little time, about 8 minutes for Q&A.